Pulmonary hypertension is high blood pressure in the blood vessels that supply the lungs, the pulmonary arteries. It's a serious condition and it can damage the right side of the heart. The walls of the pulmonary arteries become thick and stiff and they can't expand as well to allow the blood through. Having pulmonary arterial hypertension means that you have high blood pressure in the arteries that go from your heart to your lungs. It's different from having regular high blood pressure. With pulmonary arterial hypertension, the tiny arteries in the lungs become narrow or blocked. Some common causes of the pulmonary hypertension include high blood pressure in the lungs, due to some type of congenital heart disease, connective tissue disease, coronary artery disease, high blood pressure, liver disease like cirrhosis, blood clots to the lungs, and chronic lung diseases like emphysema. Pulmonary hypertension cannot be cured, but treatments can reduce your symptoms and help you to manage the condition. If the cause is identified and treated early, it may be possible to prevent permanent damage to your pulmonary arteries, which are the blood vessels that supply the lungs. A positive D-dimer test can indicate the presence of an abnormally high level of fibrin degradation products. It indicates there may be a significant blood clot, a thrombus formation, and breakdown in the body, but it doesn't tell the location or the cause. The doctor can order a D-dimer blood test to help to diagnose or to rule out the presence of a pulmonary embolism. More than 1/4 of the patients with COVID-19 had elevated D-dimer levels up to 4 months after diagnosis. This is according to a study published in the Journal of Thrombosis and Hemostasis. Persistent fatigue, breathlessness, and reduced exercise tolerance have been reported after an acute COVID-19 infection. This is indicative of pulmonary hypertension. There's also been an increase in microclotting in the lungs noticed by some doctors in the patients who've received COVID-19 vaccines. Coenzyme Q10 plays a few critical roles in the body. For example, the body's cells need this compound to produce the energy that allows them to function. And as an antioxidant, CoQ10 also protects the cells in the body by neutralizing free radicals. This reduces oxidative stress. CoQ10 supplementation improved hemoglobin and red blood cell maturation in patients with pulmonary arterial hypertension. This could confer a clinical benefit, according to findings in a new study. The best form of CoQ10 would be ubiquinol in doses of 200 to 400 milligrams per day. Coenzyme Q, or ubiquinone, is a lipophilic molecule and is present in all tissues and cells, and it's located mainly in the inner mitochondrial membrane. It's composed of a redox-active benzoquinone ring conjugated to an isoprenoid chain. The CoQ10 increases the ability of complexes 1 and 2 to transfer electrons down the mitochondrial electron transport chain, and therefore it can reduce mitochondrial superoxide production. The mitochondria are responsible for generating ATP, or adenosine triphosphate, which is the energy source of the body. Pulmonary hypertension is a heterogeneous and fatal disease of the lung vasculature, where metabolic and mitochondrial dysfunction may drive the pathogenesis. Similar to the Warburg effect in cancer, a shift from mitochondrial oxidation to glycolysis occurs in diseased pulmonary vessels and the right ventricle. You could see my other video on mitochondrial boosting supplements for more information about supplements that can help, and particularly the research chemical SR9009, which makes the body dump damaged mitochondria and regenerate new healthy ones. The initial diagnosis of a patient who presented with idiopathic pulmonary arterial hypertension and an injection of a vasodilator was given. However, the dyspnea and the fatigue subsequently got worse. Tracing back the family history, together with electromyography, nerve conduction studies, and the results of muscle biopsy, mitochondrial disease was confirmed. After a treatment with vitamin E, vitamin B2, ATP, and coenzyme Q10, the patient's condition improved. This means that pulmonary hypertension should be considered as another potential manifestation of mitochondrial disease. Cardiac complications like pulmonary hypertension are the leading cause of death in beta thalassemia patients. L-carnitine, due to its role in fatty acid oxidation, might help to control the elevation in the pulmonary arterial systolic pressure. L-carnitine has also been implicated in decreasing insulin resistance through mechanisms that are associated with the nitric oxide pathway. Evidence from epidemiological studies has shown a strong correlation between insulin resistance and increased blood pressure. You could check out my video on type 2 diabetes for many other natural ways to help to reduce insulin resistance, such as with berberine, cinnamon, chromium and vanadium. Typical doses of L-carnitine are up to 3 grams per day. This can also help to boost brain power, especially when combined with nootropics and choline. You could check out my video on choline and my other video on nootropics and racetams for more information. In a trial, persistent pulmonary hypertension in newborn in a neonatal emergency room, due to the failure to achieve a normal cardiomyopathy adaptation following delivery, was investigated, and a clinical trial to assess the efficacy of magnesium sulfate in the treatment was conducted. Over a period of 2 years, 12 newborns were admitted consecutively to the neonatal intensive care unit with severe hypoxemia due to the persistent pulmonary hypertension, and they were included in the trial. A loading dose of 200 milligrams per kg of magnesium sulfate was given over a period of 20 minutes, followed by a continuous infusion to obtain a serum magnesium level between 3.5 and 5.5 millimoles per litre. The oxygen index and alveolar arterial oxygen gradient showed a significant improvement within 24 hours of treatment. In the study, the magnesium sulfate was found to be a safe, effective pulmonary vasodilator. Magnesium sulfate could be used as a first-line vasodilator in developing countries because of its low cost and its high efficacy. Parenteral magnesium sulfate is easy to administer and to monitor during treatment. When the magnesium sulfate is used, systemic hypotension can be adequately controlled with the ionotropes. If you're unable to get intravenous magnesium, one of the next best options would be to saturate your cells with magnesium bisglycinate. Start by slowly increasing your daily dose until side effects like stomach discomfort or diarrhea are noticed. Then reduce this dose until you're taking the maximum daily amount that doesn't cause any stomach discomfort. Maintain this dose indefinitely. As magnesium is required by over 300 enzymes in the body, it can have profound positive benefits to many aspects of your health over time. One of the latest studies revealed there's an existing correlation between a vitamin K deficiency and COVID-19 severity, highlighting a role of vitamin K, probably via coagulation modulation. In agreement, other recent studies also indicate that anticoagulant treatments can reduce mortality in severe cases. Altogether, potential mechanisms linking COVID-19 with coagulopathy, in which the vitamin K can exert its modulating role in coagulation related with disease pathogenesis, are well established. Typical doses of vitamin K2 are 100 to 300 micrograms per day. The body is unable to absorb more than 300 micrograms per day. The best form for absorption would be menaquinone MK7. Diuretics are used to treat fluid retention due to pH and to reduce hepatic congestion and peripheral edema. Moreover, diuresis can prevent a distended right ventricle from impending left ventricular filling. There's many herbal diuretics such as dandelion, burdock, parsley and horsetail. Too many diuretics may lead to an electrolyte imbalance, however, so care should be taken. The Aalborg University Hospital in Denmark examined the relationship between different levels of serum potassium and mortality among 19,549 patients with chronic heart failure. Potassium levels within both the lower and the upper levels of the normal range were associated with a significantly increased short-term risk of death. Likewise, potassium below 3.5 micromoles per litre or above 5 micromoles per litre was associated with increased mortality. This would indicate the benefits of assessing your potassium levels and then supplementing accordingly. There's also a relationship between sodium in salt increasing blood pressure and potassium balancing this effect out and reducing the blood pressure. This could be of particular benefit for pulmonary hypertension. Also be aware that prescription diuretics as well as herbal diuretics can cause you to lose potassium, therefore requiring higher supplementation. Decreased availability of endothelial nitric oxide and activation of the hypoxia-induced family of transcription factors are both consequences of vitamin C deficiency, and they're believed to be mechanisms contributing to the pathogenesis of the pulmonary hypertension, and these symptoms were shown to have resolved following vitamin C supplementation. For severe cases, the best form of vitamin C would be intravenous. The next best would be a liposomal vitamin C, which you can learn to make cheaply at home in an ultrasonic cleaner. Then you have non-acidic buffered vitamin C, with the worst form being a cheap acidic ascorbic acid. Taurine is found naturally in meat, fish, dairy products and human milk, and it's also available as a dietary supplement. Research shows there's a link between higher taurine levels and significantly lower rates of death from heart disease, as well as reduced cholesterol and blood pressure. Taurine may help to reduce high blood pressure by decreasing the resistance to the blood flow in the blood vessel walls. Typical doses are 1 gram taken 3 times per day. However, higher doses are sometimes used. The herb yarrow may lower blood pressure slightly, and it could strengthen the effects of prescription drugs taken to lower blood pressure. It's used in folk medicine for the treatment of overactive cardiovascular and respiratory ailments. It has hypotensive, cardiodepressant, vasodilatory and bronchodilatory activities. It's also known to help strengthen the arteries and to reverse and treat blood pressure problems such as varicose veins. Hawthorn is used for diseases of the heart and blood vessels such as congestive heart failure, chest pain and irregular heartbeat. It also may be used to treat both low blood pressure and high blood pressure, hardening of the arteries, which is atherosclerosis, and high cholesterol. It's considered by some as an adaptogenic herb for the heart, helping to normalize and strengthen its function. It's closely related to the apple tree, therefore the berries can not only be taken in a tablet or tincture form, but they can be incorporated into many recipes. Small doses of allicin, the active metabolic in garlic, proved to be effective in preventing a severe form of pulmonary hypertension in rats. This is according to a study that was reported at the Experimental Biology 2005 meeting in San Diego. By crushing raw garlic and letting it oxidize for 15 minutes before consuming, you activate the allicin. Fermented kyolic garlic also has other benefits for blood pressure problems. Vitamin D deficiency activates a renin-angiotensin-aldosterone system, and this affects cardiovascular systems, and the activation of the renin-angiotensin-aldosterone system is associated with pulmonary hypertension. You can get a 25-hydroxy vitamin D blood test and then supplement with vitamin D3 to fix any deficiency. In a new study, a team of Chinese researchers discovered that polysaccharides that were derived from astragalus may be used to improve the symptoms of pulmonary arterial hypertension. Based on the results, the research team found that the treatment with the astragalus polysaccharides reduced the monocrotaline-induced pulmonary arterial hypertension. In addition, the treatment eliminated oxidative stress, promoted vasodilation, and it reduced inflammation, all of which contribute to lowering high blood pressure. Lack of oxygen can cause hypoxia. Pulmonary hypertension is a complication for those who are subjected to environmental hypoxia. As a result, living at a high altitude and those who are suffering from chronic hypoxic lung disease, like chronic obstructive pulmonary disease, cystic fibrosis, and asthma. Cordyceps sinensis extract suppresses the hypoxia-induced proliferation of rat pulmonary arterial smooth muscle cells. For more ways to treat hypoxia, check out my other video on masks and hypoxia for some alternative solutions such as methylene blue, vitamin B12, iron, haritaki, and various nootropics. Nitric oxide is a molecule that's produced naturally by the body, and it's important for many aspects of your health. Its most important function is vasodilation, meaning that it relaxes the inner muscles of the blood vessels, causing them to widen and increase the circulation. Nitric oxide production is essential for overall health because it allows blood, nutrients, and oxygen to travel to every part of the body effectively and efficiently. In fact, a limited capacity to produce nitric oxide is associated with heart disease, diabetes, and erectile dysfunction. Some ways to increase nitric oxide production are consuming 1 teaspoon of L-arginine with 1 teaspoon of L-citrulline on an empty stomach, first thing in the morning and last thing each night. This could be sweetened with stevia for taste if required. Other ways involve eating beetroot, eating green leafy vegetables, and taking reduced glutathione. For more information about the herbs or supplements mentioned in this presentation, go to my website.